brings the number of cases in California now to 3, the other 2 in Los Angeles and Orange counties. KPIX5's Len Ramirez joins us from San Jose right now with what we know about the new case right in Santa Clara County. Lenny?
Well, Ken, this one confirmed patient in Santa Clara County is in stable condition and sort of self-quarantined at his home. And officials say that he is doing the right thing by staying away from others at this time. They believe that for that reason, the virus is not currently circulating in Santa Clara County. Public health officials say they were not caught off guard that a case of the novel coronavirus has surfaced in Santa Clara County.
Since we are a large county and many of our residents travel frequently for business and personal reasons, we're not surprised to be announcing the first case in the Bay Area and in Northern California. Actually, we've been preparing for this possibility for weeks.
Dr. Sarah Cody said the Centers for Disease Control confirmed the case this morning, saying the man with the novel coronavirus was recently traveling in Wuhan, China, and then Shanghai, landing at Mineta San Jose International on January 24th. They also said he did the right thing.
Since his return home to the county, he has been self-isolating at home and did not leave home at all, except to seek medical care.
Health officials say the man did visit a local clinic when he began to show symptoms, but he was not sick enough to be hospitalized. He reportedly is cooperating with health officials and is self-isolating at home.
We are currently reaching out to anyone he may have come into contact with to assess whether they may have been exposed to the novel coronavirus. Our preliminary investigation indicates that he came into contact with very few individuals after returning home.
Health officials are not saying what clinic he visited, but persons he may have come in contact with there and his own family members are being monitored for symptoms and instructed to stay at home away from others. And people who were on his plane are also being contacted.
We refer all details around flights to the Centers for Disease Control, and they follow up in the event that he might have been infectious while on an airplane.
Now, obviously, this is a very serious concern for health officials right now, but because of the actions of the one patient, they do not believe that there's any person-to-person spread in Santa Clara County right now, but they are monitoring that very carefully and will do that in the coming weeks. Liz, back to you.
Yeah, and Lenny, this next development will stop a lot of folks in their tracks. There's now evidence patients can spread the virus before they show any symptoms. How concerned are health officials about that?
Well, obviously, they are very, very concerned about that. In fact, the CDC at a news conference today said that it is a big concern because even a negative lab test does not mean that someone is out of danger for carrying the virus or spreading to others. So somebody may have it, may be spreading it to others and not even know it, and that is a very big concern. So health officials and doctors are working on a better test to be able to detect it more readily in someone, and that is the reason for all the caution and all the things that are happening right now with travel bans from people coming into and out of that area. So it is a big concern and it is something that they're trying to fix.
All right, Len, thank you.